There are some epigenetically active drugs that have recently been developed, and kind of it's difficult to understand exactly what they're trying to do with these drugs unless you take a step back and discuss what's going on in myeloma. And so one of the important features is these chromosomal translocations, where one bit of DNA moves to another region of the genome and overexpresses a gene here. And so assume that this gene is essential to making myeloma cells grow quickly and be resistant to treatment. And you could give it a name, you can call it MYC, and MYC is important in doing that. And so you want to downregulate MYC if you can, because the cells will behave better. And what we know is that in this bit of DNA that's moved tends to contain enhancer sequences that overexpress genes when they land next to them. And so the way to control this bit of DNA are with kind of molecules that affect transcription factors, transcription, and the enhancer activity of that site. And so really that's what we're trying to do with these epigenetically active agents, like the ones you described, the BRD4 inhibitors, to downregulate these enhancers. So MYC is downregulated and the cells behave much better as a consequence of that. And so these drugs do seem to work. It's a good rationale, it's a good logic. And by focusing on high risk, it draws attention to genes like MYC, because they're not so important in the early stages of myeloma when the cells are behaving much better. So we start to see us developing therapies that are active for high-risk disease.